Well, this evening marks the first night of Ramadan, but community members who wish to fast and get their COVID-19 vaccine may have questions about whether or not that it's safe to do so. To answer some of those concerns and more, Dr. Hashim Khan joins me now. He's a respirologist at UHN, Toronto Western Hospital, as well as a member of the Canadian Muslim COVID-19 Task Force. And that title is key when it comes to talking about what happens now that Ramadan is beginning. Good morning, sir.
Good morning. Thanks for having me.
So let's talk about that. People that are celebrating Ramadan, but at the same time making sure that they want to get a vaccine. How do the two coincide?
Yeah, so as you know, Muslims are fasting starting yesterday or today, and there's lots of questions about whether or not Muslims can receive the COVID-19 vaccine. So I just want to reassure everyone that from a religious perspective, there's nothing to prevent them from getting their COVID-19 vaccine while they are fasting. So there shouldn't be any issues in that regard.
And when it comes to hesitancy, we've talked about this over the course of the weekend when some of the pop-up vaccine clinics did, in fact, get a lot of attention. So what do you think? What's your advice for those people that are actually still wondering and waiting about whether or not they should actually get their shot?
Yeah, that's a good question. So as we know that there was a lot of vaccine hesitancy several months ago, and those levels of vaccine hesitancy have been coming down. I think mainly because lots of people have been seeing friends and family, whether here in Canada or across the world, have been getting vaccinated. And some of the concerns about, safety and side effects that were initially on people's minds many months ago, they are less prevalent, and so they're a bit more reassured. So what I would suggest is, reach out to your local family doctor or nurse practitioner, speak with them who you have a prior relationship with, someone who you trust, speak to someone who's received the vaccine, and that might address some of your concerns.
We've heard a lot from local government talking about getting local community groups out to discuss this matter with specific communities. Do you think more information needs to become available?
Yes, I think so. I think, especially when it comes to improving messaging and improving uptake of vaccinations, whether it's the COVID-19 vaccine or all vaccines in general, I think we should do our best to try and improve how we are disseminating that information in different languages and culturally sensitive manners and ways, and trying to get that information out as quickly as possible. As we know, information that might be a bit more negative, a bit more scary, tends to spread much faster. And it's our job as either governments or public health professionals or even medical professionals to try and put that into perspective and to reassure when needed our patients.
All very important, especially with the start of Ramadan tonight. Dr. Hashim Khan, thank you for joining us this morning.
Thank you for having me.
All right, Dina, Sid, standing by with a little chat for us.